Good morning. My name is Nan Freund, and on behalf of the Association of Educational Therapists, it's my great pleasure to welcome you to the first part of our webinar, Recognizing and Supporting Students with Nonverbal Learning Disabilities. This webinar is an adaptation of a wonderful presentation that was given at the AET National Conference in October 2015. But before we begin, I want to share a little information about the Association of Educational Therapists. AET is the National Professional Association for Educational Therapists. AET sets standards and ethics for the professional practice of educational therapy and provides ongoing professional development for its members and the public. And now, through the magic of technology, I'm delighted to introduce today's speakers who span the country. Marion Marshall comes to us from Oakland, California. She's a board-certified educational therapist, a fellow of the Association of Educational Therapists, and an associate professor at Holy Names University, where she's the director of the Educational Therapy Certificate Program. She's an award-winning educator who's taught in public and independent schools and has been an educational therapist for the past 20 years. She's a frequent presenter at regional, statewide, and national conferences. Dianne Matthaei is in Tacoma, Washington, where she also has been an educational therapist in private practice for the past 20 years. She's served as a differentiated learning specialist and a teacher of mathematics. Her business, Lighthouse Learning, LLC, provides assessment and instruction for atypical learners of all ages. As an educator recognized for excellence in teaching and the parent of 2 atypical learners, Dianne provides workshops for teachers, therapists, and parents alike. Rebecca Schatz, who's in Chicago, where I also am, is a pediatric occupational therapist. She works exclusively with children who have sensory processing disorders, learning disabilities, and pervasive developmental disorders. She consults to and provides training for elementary school teachers in motor skill development and sensory integration techniques to use in their classrooms. In addition, she leads parent discussion groups to enable parents to incorporate appropriate therapy ideas at home. All 3 of our presenters are contributors to the book, Treating NVLD in Children. You can see an image of it there on your screen. Professional Collaborations for Positive Outcomes. As you can see, we have a wealth of experience and knowledge here today. So please welcome Marion, Dianne, and Rebecca.
I think that was a terrific introduction. We hope in this version to talk about what NVLD is and what it is not. I know that some of you are interested in this furthering information about the social aspects, transitions to work, school, higher education, and those chapters. There are other chapter authors that have that information for you. So I would recommend that you read those chapters. This is also now an ebook. And behind every chapter is a list of wonderful resources. So if the topic that you're particularly interested in is not addressed today, I refer you to those other sources. NVLD is a type of learning disability. It's not about students who are nonverbal. And we're hoping to make distinctions today that will help you understand the differences between this and Asperger's and some other sensory issues. It's seen in both males and females. It's not well understood, and it's often misdiagnosed. I think there's at least 4 places for confusion. The first is NVLD. Those initials also stand for nonverbal learning disabilities, as does NVLD. Why does the same condition have 2 different abbreviations? Not clear. There's the first. The second is that it's often commingled with Asperger's. If one is looking primarily at the behavioral aspects of NVLD or the sensory processing issues of NVLD, one might come up with the notion that it is, or the diagnosis that the student has Asperger's syndrome. There's another place for confusion in that NVLD has never been listed as a subtype of a specific learning disability. And so I think not enough people know about it, and not enough people recognize it when you see the condition. And lastly, Asperger's is no longer listed in the Diagnostic and Statistical Manual, the DSM-5, and so it has become blurred among other in the autism spectrum. So I think that we have at least 4 places for possible confusion. NVLD is global in nature, and we're going to hear between the 2 webinars that there are a series of conditions that often roll out, and if one has not had a formal neuropsychological evaluation, it's very possible for someone to look at each presenting issue and think, oh, now we have a sensory processing issue. Oh no, it's more about social skills. No, now it's about difficulties in school, academics that we didn't anticipate. It's very global in nature because we'll talk about how it moves through the ages and the grades and can look different at different times of development. And I've said this, that the presenting issues can appear different at different ages. Dianne, would you talk about how often NVLD occurs?
Certainly. Thank you, Marion. Well, if we look at the whole population of those diagnosed with a learning disability, we would think that the NVLD is probably about 5 to 15% of that group. And as Marion mentioned, it's somewhat difficult to get a really exact count because some neuropsychologists will diagnose NVLD, and others might just say learning disorder NOS, which stands for not otherwise specified, which is a rather generic category. So it makes it somewhat difficult. And as Marion mentioned again, the name is a little confusing because it really isn't about students who are nonverbal. It's about a learning disability that's not verbal. In other words, the NVLD individual has strengths, mainly strengths in the verbal area and difficulty in other areas, which of course begs the question, what other areas? I think this definition is really one of the best. Nonverbal learning disabilities impact one's ability to manipulate, integrate, and learn from nonverbal information. Nonverbal information being information like spatial information. Where is my body in space compared to objects and people around me? Or visual spatial information. How do 3-dimensional objects look when you view them in 2 dimensions on a piece of paper? Or social information, gesture, tone of voice. Any of those kinds of information become difficult for individuals who have NVLD. Now the rest of this presentation, and especially part 2, we will delve into these difficulties and see how they look at different times and ages. And even more important, we'll be emphasizing what actions can educators and parents take that would make to help mitigate against these difficulties and build more positive outcomes for individuals. Now, the early research was done by people like Byron Rourke, who's an MD, and he started the term NVLD. But as we do more research on this fairly newly diagnosed disorder, we may see a name change. We've certainly seen that in other disorders. And as we get better tools and more research, we may be calling this a VSLD, which is the Palumbo group out of Italy, like that term. So you may see that, or that may become a subtype. But I think we may just be prepared for new advances in this particular disorder, which I think will be really exciting to see. And again, I refer you to, there's a nice overview of the history if you want to read the first chapter in our book. Now, Marion, will you describe more about the assets that people with an NVLD have?
Happy to, Dianne, thank you. So early speech is a marker, strong spoken vocabulary, good rote memory skills, early acquisition of reading skills, strong spelling skills, very strong verbal expression, But I want to introduce to you just the beginnings of the story of how I met my first ever student with NVLD. I'll call him Jake. So Jake came to me to do a limited assessment about difficulties with writing, 3rd grade, difficulties with writing, highly verbal child. And at that time, the first time I met him, I greeted him, we're building up some rapport, and he said he was tired. I thought tired is not the way to start an evaluation. And so I said, why are you tired, Jake? And he said, oh, I went to the theater last night. I said, really? What did you see? And he described the play, which is clearly for adults. It's not a child's production. And I asked him what he thought of the play. I wondered what he could possibly have gotten out of the play. And he gave me this incredible critique full of high-level vocabulary. And I thought, did he get this himself, or did he hear this in like the theater lobby and glom onto it and remember it? So do you see number 2 and number 3? Jake was evidencing really strong vocabulary because he seemed to understand most of those words, and he had wonderful rote memory skills. And you'll hear more about Jake and my discoveries about nonverbal learning disabilities through him next time. Again, strong auditory memory skills. Jake remembered, I think, someone either in the car or in the lobby who was discussing the play in great detail.
Okay, how about, so we talk a little bit about difficulties now. And I do want to stress that that folks with an NVLD really do have wonderful assets, and we want to lead with those strengths. One of our goals is to help individuals identify their strengths and be really strength-based. And Marion talked a lot about the academic strengths, and of course there are other areas too. I've worked with a couple of students who were remarkably talented musicians. So we want to always remember the strengths that our students have, but we can't underestimate their difficulties either. These are real, and they present a number of problems. And the first one you might encounter with a young child especially is the motor. Gross and fine motor skills are often difficult areas. It takes longer and takes harder work for a child to acquire gross and fine motor skills such as tying shoelaces, using a scissors, writing neatly or semi-neatly on a line, riding a bicycle, or parallel parking a car. Rebecca will talk more about these later. And another really core area would be the visual spatial area. As you read through the list there, there's a lot of them you'll notice, and you sort of might be wondering, so what in the world is faulty visual perceptions? What could that be? Excuse me. Well, let me tell you a little story about one of my students. I'll call her Sophie. And each day we would walk into the school building, her school, through the front door. But one day there were workmen working away on repairing the front door, so we walked around, went in a side door. And then we were standing by her classroom, and she viewed the door from the inside now. And all of a sudden she tugs on my arm and exclaims, "Guess what? It's the same door." So this was like newsflash. She had seen this door from the outside. She had seen it from the inside. She had never realized it's the same door, just viewed from two perspectives, until she had the cue of the workman. And that would be the sort of thing that we didn't know. She thought it was several doors, but she thought it was. And I think that I always have a good time sharing that story because it might remind you of other ones. Oh, that would be the child that didn't recognize the dog once it had a haircut. Other perhaps perplexing situations that you had seen. That can be the result of faulty visual perceptions. Or you can imagine too, if your visual perceptions are a little fuzzy or inaccurate initially, then recalling them out of memory isn't going to be easy either. Individuals with NVLD report that they get lost easily. They don't remember markers that they should. They get lost in places where it's embarrassing. It's your own neighborhood. But they'll say things like, I can't remember what did the house look like, where I was supposed to turn. And they'll report that I can go from home to point A and home to point B, but I can't get from A to B unless I go back home. So it's a bit of a problem for them, and say it can be embarrassing. And another area that Marion touched on earlier would be social perceptions. You know, if 70% of communication is nonverbal and you struggle with nonverbal information, this could be a problematic area. For example, this could be the sort of thing that an individual may talk a little too loud, stand a little too close, monopolize a group conversation, or withdraw from it instead of being just a participating contributor. And obviously you can see for this one, it's a real overlap with the diagnosis of Asperger's. So sometimes it's a little bit difficult to say which one are we dealing with here. And obviously each one of these difficult areas impacts the other. For example, if a child doesn't learn the motor skills that most of his classmates have, he may be left standing on the sidelines. If everybody else rides a bicycle, he's standing there watching the other children ride around the cul-de-sac. He misses out on social interaction. Or if a young girl feels like she's just an absolute klutz on the dance floor, she's probably going to be hesitant to go to the middle school dance. Okay, let's move on to the next one then. Another area of real difficulty is executive functioning. And we're getting quite a bit of attention to this area, and especially this is an overlap, obviously, with the students with an attention deficit hyperactivity disorder. So again, a little bit of confusion there. But this is a very important area, and look at all those skills that are important in school and important in life. And let's just take one, for example, saliency determination. Individuals with NVLD struggle sometimes to determine what is salient, what is really important. And so you'll ask them things like, now, what's really important for you to know for this test? And they'll say, everything, I have to know it all. Everything's important and I have to know it by tomorrow. So these are difficult skills. They're going to need extra instruction, extra support to learn how to problem solve and how to sequence and how to establish goals. And these are very important skills, but in a number of ways, but sometimes we forget how important they are in academic skills. Marion, would you like to comment on the writing?
Absolutely, thank you, Diane. So when we think about the role of executive functioning in writing, I think we're just understanding and starting to appreciate how important the executive functioning skills are. How do you decide if everything seems equally important, what to leave in and what to leave out in a paragraph? How do you decide if you can't quite tell if everything has equal weight? How do you decide to sequence through an essay? How do you take notes in middle school and high school? Do you have to write down every single thing because everything is important? It's very challenging, and we'll spend a little more time in part 2 talking about that.
Thanks, Marion. You can see how these difficulties could lead to a whole sense of overwhelm in any one of the sensory modes. For example, visually, we often ask our geometry students to, find the measure of angle XYZ. And then we show them a drawing with lines and points all over, and the poor student is going, I can't even find angle XYZ. Where's Z? Get me out of here. So it's just very overwhelming at some points. And we'll be discussing more about reading and math in part 2. And I'd have to say that mathematics often ranks as the most feared subject for students with NVLD. But the sense of overwhelm can just be visually or maybe tactily. Students often say that as a young child, the parents will comment that the child only wants to wear sweatpants because he considers denim or cotton just too scratchy. So they just want to spend their life in sweatpants, and the poor parents are out there trying to find formal sweatpants for other occasions. But the sense of overwhelm is real. And I do want to refer you to the YouTube video by the editors of our book, because I think it's very, very particularly parent-friendly. It's had a lot of views. I think you can feel very comfortable referring parents or others to this YouTube video by Drs. Brightman and Davis as another source to learn more about this particular area. Okay, next slide, please. And there really is an ongoing debate as a newly diagnosed one. There's a real ongoing debate about, is this a syndrome? Is it a white matter disorder? White matter referring to the white matter connective tissue in the brain versus the gray matter? Is it manifestations of overlapping conditions? And again, we want to stress that this disorder is complex. And we can't just simplify it and think it's very specific because that's what our category says. It's a complex one. It's best to use a multi-dimensional model, and it requires a multidisciplinary team. Team building and communication are really vital to adequate and support for really positive outcomes. So now Marion's going to tell us more about this multidisciplinary developmental approach.
The book takes the developmental approach because it may appear that students morph, that the issues change with grades or developmental levels. And I think it's important to help along a path of a parent and child, help them to understand that this is an ongoing condition, that the people they'll need to seek and put on their team may grow to be quite a number. Considering time and resources, it may be very important to figure out how to prioritize who to put on the team, who's going to be case manager. And as I said, a younger child may never have had a neuropsychological evaluation, a full cognitive profile approach to the individual. A younger child at 4 and 5 isn't really the right age to have a neuropsychological eval. More like 7 or 8 would be the ideal ages. And so it may be that you start to meet allied professionals one at a time. Rebecca's here as a part of this webinar because she's likely the first person that a student who hasn't had a full neuropsych eval is going to need on their team and working with their child. So it's important to think about the overview, how many services can be provided, what order to provide them in, who's the case manager, who's going to share out and disseminate information across the team, and eventually any number of specialists will be involved with a student. So I've said this point 2. I've said that there are other chapters for information about social emotional issues, transitions to college, employment and work, because this type of learning disability is really lifelong. It doesn't end when you finish geometry, Dianne. All done with NVLD because we finished geometry and now we're on to better things in life. And I had someone email me recently just because of the webinar saying that he had difficulties at work because he had to explain to his coworkers he couldn't remember the copier code. He would have to verbally say it out loud in order to access this from memory, what it is that his copier code he needed to do to copy. So there are things like that that seem small and subtle, but are pervasive throughout adulthood as well. And now I'm hoping this is very helpful, and this overview helped to delineate what is NVLD and what is not, and where the overlapping places and confusions are. And now it's my pleasure to introduce Rebecca Schatz, occupational therapist, as one of the first people who would likely work with a student with NVLD. Rebecca?
Thanks, Marion and Dianne. So I'm going to start to discuss the role that the occupational therapist would play in working with children with NVLD. The 2 main components that I'm going to be discussing with you are going to be the sensory processing challenges, how to identify those sensory processing challenges that they experience, how to address them as well, and then looking at the motor components, specifically in terms of things like motor planning, how they execute motor actions, as well as looking at handwriting in particular, since OTs spend a good amount of time in handwriting. When a child comes in to see an occupational therapist, the first area that we're going to evaluate is their motor skills. So some of the motor skills that we'll look at are things like bilateral coordination. Some of those type of skills are things like bicycle riding, scootering, swimming, ball activities that involve that right and left side of the body. That happens to be a lot of the motor activities that children with NVLD shy away from because those are challenging for them. So an occupational therapist is really going to look at how they can maneuver themselves in terms of using right and left sides of their bodies together. We'll look at balance. You know, how are they able to stand on one foot? How are they able to walk on a balance beam? All kinds of, again, components within the motor systems that are critical for day-to-day activities. Motor sequencing is a big area that we both evaluate and treat with children with NVLD. Motor sequencing is that ability to do a motor sequence by following a set number of steps. And so if you take, for example, I have a climbing wall in my office, I would look at how the child climbs up the climbing wall. And if you look at that activity, there are many components in figuring out how do I move my hands and feet as I climb up the climbing wall? What do I do when I get to the top? How do I figure out how to get back down? So all of these sequences go into the activity of something like climbing a wall. So those are, that's one example of something that we might look at in terms of their motor sequencing. Body awareness is looking at how they maneuver themselves in space, both in relation to themselves as well as their peers. We'll look a lot in the clinic in terms of how they're moving around when they're playing a game with another person or with myself. We'll look at school in terms of how do they maneuver themselves around the classroom. Postural control is another important piece that occupational therapists will look at. It's especially key for things like learning when sitting on the rug or sitting by your desk, and doing writing activities in particular. Last, an OT is going to look at a child's fine motor skills. And here we're going to look at pencil grip. We're going to look at how they are able to manipulate various different materials, some of the home-based activities that involve day-to-day type of activities. After the OT looks at the different areas of the motor piece, and we'll get to the sensory in a little bit, we'll start to intervene in terms of those particular activities that are challenging for the student. Sensory motor integration is one big way that we involve the child and involve all the senses. So we're not just talking about taste and sight and smell and hearing, we're incorporating other sensory systems such as the tactile system, which is our sense of touch, vestibular system, which is our sense of movement, and proprioceptive sense, which is our sense of our position in space. So the child in sensory motor integration is an active participant in the therapy, and it's leading to an adaptive response. Brain gym is another type of technique where we're teaching children to learn through movement. And this is coordinating the eyes, the ears, hands, and body. And we've seen nice documented changes, including improvements in attention, in focus, in memory, as well as coordination. Interactive metronome is a computer-based therapeutic intervention that works with timing in terms of motor activities and sounds, and it's coordinating sounds and movements together and how we react to those sounds. There have been really nice documented changes in interactive metronome in terms of motor planning, sequencing, fine and gross motor skills have been shown to be improved, attention, as well as bilateral coordination using both sides of the body together. And this type of program is done both in clinic settings as well as there's a program that can be used at home, so parents can do that directly with children. ILS is Integrated Listening Systems. It's a multi-sensory program which combines auditory information with balance, with movement, as well as visual motor tasks involved. So now the second big piece that an OT is going to work with an NVLD student is the sensory processing piece. In order to understand the sensory processing piece, it's a little multi-layered in terms of the assessment. Sensory profiles are given to the parents or other caregivers, as well as the teachers, and that information assesses a student's sensory processing in all of their environments, school and home, and really looking at what are those areas that they're feeling challenged by. In addition, we'll look at sensory processing in the clinic as well. So the sensory systems, which I had previously mentioned, which as an OT we're going to really target and address for these type of students, is the tactile system, the vestibular system, and the proprioceptive sense. Again, just as a quick reminder, tactile is our sense of touch, vestibular is our sense of movement, and proprioceptive is our sense of position in space. So in terms of looking at the sensory challenges, and I'm going to go through each one because I think it's really key to understand the challenges that students experience in terms of their sensory processing, and then look at what are some home and school strategies that can be done for these type of students. And it's key to understand each individual area. So we have children with poor registration, those with sensation seeking, we call them the sensory seekers, those with sensitivity to stimuli, as well as sensation avoiding. So let's talk about the first type of category we see. The first is poor registration. So these are the type of children that are going to miss or notice fewer sensory cues. They may not respond to their parent calling them, may not respond if their teacher is calling them in the classroom, and their attention tends to drift. They experience a lot more difficulty completing tasks in an efficient manner, again, because they're constantly being pulled away within their environment. These are the type of students that need more concentrated sensory information so that they can notice and respond to cues within their environment. So they need a lot of strong feedback in comparison to their peers. Home strategies. So in working with different sensory processing challenges, a big part of our job is really working with parents in terms of strategies that they can use at home. So a child that has poor registration is going to really benefit from a lot of movement activities. So I help parents with movement activities that they can do before mealtime, before these children are asked to sit down. I'll talk a little bit later about some other accommodations that can be done with seating. For example, there's a bumpy cushion called a move and sit cushion, which some children will use both not just in the classroom, but also during mealtime to help give them some of that extra input, that extra feedback, so that they can sit and have a meal with their family. Another type of activity might be working with a lot of textured type of materials. So if you think about things like a bumpy ball or weighted materials, a weighted ball, that's going to give increased sensory feedback to the student who has that poor registration. One of the key pieces to address with these type of children is lots of outdoor time. So when the weather is nice, lots of movement, climbing structures, bicycle riding, scootering, swinging as much as possible. Any really heavy-based movement activities are really helpful to get that increased feedback. So what about in school? The student with poor registration, as I mentioned, their attention is drifting quite a bit. So movement breaks are really helpful for these type of students. So a movement break can be anything from stepping out of the classroom to walk up and down the staircase, getting a drink of water. It can be movement inside the classroom as well, whether or not things have to be moved. I sometimes give teachers ideas to carry heavy books, to carry some boxes within the classroom, even something like moving chairs or tables. So any kind of movement that allows that student to stand up and move around within their day is very helpful. If we look at things like writing, a student with poor registration might really benefit from having the visual stimulation a little bit brighter. So we might do things like highlighting lines for them on their lined paper to help them be able to stay within their spaces when they're writing. It's important for the teacher to frequently check in with these type of students to make sure that they've understood the directions and instructions that have been given to them. We might look again at where their seat is located in comparison to the rest of their peers. And lastly, one strategy that a teacher might use might be just a simple tap on their shoulder. That might be enough of that physical cue that helps them to bring their attention back to the task. So let's go into the next area, which is those children with sensitivity to stimuli. These are the children that are highly distracted, have increased activity levels, and they're going to have stronger reaction to their peers in terms of sensory input. They notice any changes or more things in their environment very quickly, and that frequently pulls their attention as well away from tasks. So these are the type of students that frequently are interrupted in the middle of tasks. What's important for these type of children, both at home and in school and in other environments, is to try to identify what are those sensory systems that they are feeling sensitive to. Is it sounds? Is it visual stimulation? Is it their sense of touch? Are kids sitting too close to them? Or other people approaching them too closely? So it's important to really identify what are those areas that they're sensitive to. In terms of some home strategies, these are children that really need greater predictability. So parents can help children in that area. It feels more comforting to them. Earlier there was the discussion about sensitivity to clothing, and it really is sort of a real sensitivity that if you think about a child that is sensitive to jeans, for example, if they were wearing these type of clothing, it's going to be very hard for them to attend or focus on different things throughout their day because of that constant feedback that for them they're highly sensitive to. So it's important to help them with their clothing. And as an OT, we address that sensitivity so that we can make it better and more open to different kinds of materials in clothing. They might work better in a place that has fewer distractions. So thinking about homework time, where in the house is a great spot to work where there is less sensory stimulation around them. Another activity might be heavy movement activities. Again, it's helping their bodies to get ready, to get some of that input that feels comforting and organizing for them so they can sit down for mealtime, for homework time, or to play a game. Some school strategies. Here, the teacher is going to really look at limiting the amount of steps given to these type of students, breaking tasks down and helping them step by step to be able to work through different tasks they're asked to do. They might work well seated at a desk with fewer visual distractions. Some of our younger children really benefit from visual schedules and constantly checking in with these schedules. Again, they want that predictability. So knowing what's coming next really helps them with some of those transitions throughout their day at school. These children also might benefit from wearing a weighted vest, which gives them some of that input, as well as lap weights that we have some of our younger children wear, be it at circle time or by their desk. They can have that lap weight on. Sensation seeking, this is probably the biggest of what we're seeing, which are the sensory seekers. These are the kids that are active, they are fidgeting around, they are moving. They're really continuously trying to seek out sensory information and sensory input as much as possible. They're touching things, they're moving their legs, they're constantly shifting their bodies. They're putting a lot of things in their mouth that do not belong in their mouth. So you see a lot of that chewing, tapping on pencils, etc. So what are some home strategies for these type of children? Playing with weighted materials, as I had mentioned before, are really helpful because, again, it's that heavy feedback that's going to help register in their nervous system and help them to organize their bodies. Trampolines can be effective, but we need to be very cautious with trampolines and really watching that movement doesn't send their nervous system to be too excited. So a parent really needs to be around if that type of activity is being done. Ball work is another really effective type of work. And this is the type of ball that adults use for workouts. We use them here in our clinic. And I'll help parents a lot with activities in the morning where they can do some heavy work on the balls, which also help with core and strengthening as well. And it gives them that extra input, especially before they start the day. Heavy work or jobs around the house, carrying laundry, carrying shopping bags. If they can vacuum and pushing that vacuum cleaner, unloading the dishwasher, anything that gives them some of that heavy work is really helpful. Outdoor movement, again, is really key for children who are sensory seekers. Biking, scootering, jump roping, which can be done inside the house as well, is really helpful. One last idea that I work a lot with parents are activities that they can do with their child just before they get to school. So I'll have some parents park a few blocks away and then have their student either bicycle to school, scooter to school, and if nothing else, they could even walk. So it's giving them some of that input just before they start their day. Some school strategies for the sensory seekers are things like movement breaks, again, are really key, especially before transitions. So when they're finishing up on an activity and they're having to shift gears, that might be a perfect time to take a sensory break and get some movement. Again, stepping out to get a drink of water, walking up and down the stairs, any heavy jobs that the teachers can give to these type of students in the classroom are really helpful. These children also benefit from some accommodations in terms of their seating. So a seat cushion, again, gives them some extra input, which might be helpful for them to stay on task. We also use the very stretchy TheraBands, and we put them under the chairs, and kids will just lock their legs underneath and just really push and get some of that really heavy resistance. And again, that's another great way to give them some input, especially when they're at the table trying to do some work. In terms of the oromotor, these are the kids that are doing that constant chewing. We try to give them extra input around the mouth, and that again will help calm their nervous system, get them organized and better regulated. The Camelback water bottle is a great water bottle that has a very thick straw, and kids can chew on it. So it's really helpful as one tool, as well as even things like chewy snacks, crunchy snacks are helpful. And last, if teachers are okay with it, gum chewing is a really effective technique that helps a lot of children. Sensation avoiding, our last sensory category. These are the kids that are resistant to change. They are highly rigid and pretty inflexible, and they're frequently bothered by sensory input. So they're going to choose either to move away from the activity or they're going to work on their own. And it's really important for these type of children to really meet them at where they're at. Understanding that decreased input at the beginning and decreased sensory stimulation will help them feel more comfortable. And then we want to work to slowly broaden their sensory processing range, but really done slowly and comfortably to them. So we would want to introduce very small changes within their routine and within their schedule. Some home strategies, the biggest is really providing that real consistent and comfortable routine, and then helping children when things might change on a day-to-day basis. In school, the teacher might help by limiting the amount of information that's presented to the student at one time. Again, doing a step-by-step breakdown, so helping them with the different steps, looking at their seating, where their desk is located. Really important is this comfortable routine that we want them to feel comfortable with. And the teacher can really process with the student whether there are going to be some upcoming changes within their day, and then helping them with certain strategies that they can use in these moments that might feel uncomfortable. And some strategies might include deep breathing or counting might be helpful. These students tend to have a harder time in large group work, so they might benefit from starting in smaller groups. And then the last piece that we help really work a lot with is the language to express that discomfort is really key for these type of students. I'll go quickly through some of the sensory processing interventions because I think I've talked a lot about them. The ALERT program, just to let you know, is a program that was developed to increase awareness into arousal states in organization. The How Does Your Engine Run program is a program we use a lot, which is helping kids to, and teachers and parents as well, to choose an appropriate strategy to change their level of their state or alertness. We have the high engine, we have the low engine, and helping students to get to that just right. The therapeutic listening is a really important program that's an auditory-based program and addresses some of the auditory sensitivities, visual motor, as well as sensory integration. And number one was the sensory integration, which I think I've been talking about a lot of the different activities that we do. That's really the biggest in terms of addressing that sensory processing challenge that students are experiencing. Briefly, I just want to comment on some of the handwriting components that as OTs we're going to look at for students with NVLD. So we're going to look at things like their memory, things like their memory in terms of remembering how to form the letters. Do they start in the right place? Do they have the correct sequence and direction and in forming their letters? How are they in terms of placement of their letters? Are they getting their letters within the spaces provided, or do they tend to have their letters at over top of the lines or falling below the lines? We'll look at size. Again, we have a lot of kids that have very large letters, so we're working on trying to gain that increased control so their letters can be smaller. We'll look at fine motor control, looking at their pencil grip, how much pressure they exert on the paper. We look at, those students that may be putting too much pressure and breaking their pencils. So that's a part of grading their pressure. Spacing is the last piece that we'll look at in terms of when they're writing sentences or other types of writing activities. How are their spaces between words? Some of the handwriting interventions that we'll use include programs such as Handwriting Without Tears, Benbow's Kinesthetic Writing System, and the Write On Handwriting program, which is a multisensory approach. The last piece that I want to address before I think we open it up to some questions is looking at, again, and I've mentioned quite a few of these throughout my talk, what are some of the classroom strategies and accommodations for these type of students, both with the sensory as well as the motor challenges that students with NVLD are experiencing. So the adaptive seating, I mentioned a couple ideas. Things like the bumpy seat cushion is helpful. We'll use things like T-stools or ball chairs. Again, it's helping these students get some of that extra input that their bodies are really needing to help them to stay on task and to help them to attend and focus. The band I mentioned can be put under their chair. And more we're seeing classrooms that are having children use standing desks with foot pedals. And again, those foot pedals are giving them that sort of motor activity to help keep them on track. Movement breaks, as I mentioned, are helpful both in and out of the classroom, again, to get them through transitions when they're having to move to a different activity. Heavy work activities are really important to think about, and it really can be anything that gives them that extra input. We had some young children doing a work activity where they were carrying huge containers of paint to another classroom. So again, it gives them that heavy work that they can do, getting them to go outside of the classroom. Visual schedules, as I mentioned, are really key for students with NVLD and helping them to anticipate their schedule. Various kinds of prompting, again, whether it's something physical or verbal. A quiet corner is something that I work with a lot of teachers on helping to develop a space where these type of students who have some of these sensory processing challenges can go to either take a break or to even complete their work. So even things, if it's possible to have something like a beanbag chair in a corner, we'll have some of their sensory tools in that corner as well, so that they have a place to go to when they're really feeling that they're not well regulated and having a difficult time. As I mentioned, gum chewing is a really effective oral motor activity that really helps give some of that input to students to help them to regulate their nervous system. Different type of writing implements. These might be things like pencil grips or other types of special pencils. We'll use all different kinds of things to help those students with the challenge of writing for it to feel more comfortable. We might use slant boards. We use all different kinds of paper. And as I mentioned, even things like visual cues with highlighting lines can be very helpful for them. And the last piece within those students is we do work on some keyboarding as well. And what I just want to mention is sometimes for these students, it's really important to break up their different modes of written output, I should say, so that sometimes it's helpful that they have some opportunities for handwriting, whether it be print, if they are doing some cursive, and the rest of it can be keyboarding. And when it's divided up, that helps them to feel more effective when they're doing written expression activities. So I think we're now opening it up to questions. I'll pass it over to Nan.
And thank you very, very much, Rebecca, Marion, and Dianne. What a lot of information in a short amount of time. And I know several of you in the audience were asking us if we could slow down. It really, we could have done an hour on each part. The good part is that you will have the video. You can go back and watch the video when it's available, and you can pause it and take your notes. If you didn't get the handout, it's also available on the AET website. We have a number of questions, and we went fast because we wanted to save some time for questions. And we're happy to stay on a little bit after our normal closing time. If you all would like, you're invited to stay. The first question that came in, which is a big one, Maureen asked, what do you think of the professional controversy that NVLD is not a separate, distinct diagnostic category, but is just a variant of HFA or Asperger's? She said, I know this dialogue has been going on for some time without a resolution. There are studies to prove each point. Would one of you like to answer that?
I'll start and then I'll yield to Dianne. I think there is significant overlap between the two populations, and that's primarily where the confusion comes from. In fact, there's a Yale study that could be looked up where there are as many as 80% of students with NVLD could be classified as Asperger's, so that leaves us 20% not. And I think the key difference is the visual spatial difference. If we just look at the behavioral, the sensitivities, that Rebecca was talking about, and the kind of behavioral manifestations, then that's where the blur happens. But a really good look, evaluation, I said before, like a neuropsychological, will tease out the visual aspect, the visual spatial aspect, and that's the key difference. And that answers one other question too but go ahead, Dianne, want to add to that?
Well, I would certainly agree. I think that the visual spatial is just a core part of the nonverbal. And I think that we need to really key in on that with these students with a nonverbal learning disorder. I also think, part of me says, I'm really happy to let some of the neuropsychs work that out. Meanwhile, back at the ranch, what are we going to do to help these kids? I think we will get better and better diagnoses, and that's going to be very helpful. But I do think part of my primary interest is what are we going to do that helps them? What actions can we take? I know Rebecca gave us a lot today, and Marion and I will be continuing on that to say what is an effective intervention across the board for these individuals. So that's a lot where my interest lies, and I think for a lot of folks out there too. We understand that some of the neuropsychs will be debating this for quite a while, but until they get it all worked out, we're just going to proceed on how do we help folks.
Good. I answered Donna online that she said, is there always a visual difficulty? And I answered yes, and I wanted to follow up for the rest of the group, which is, it's not just a visual difficulty as in acuity, it's visual processing and visual perceptual difficulty. So if you can understand that distinction, we'll talk a little bit more about it next time.
Thank you. That was a wonderful, thorough answer. Stephanie asked, while this issue is not uncommon in other children who are not diagnosed with NVLD or AS, I often encourage children to learn to keyboard as early as 3rd grade if it helps with written output. From an OT perspective, how do you broach this transition with parents and support this if the family can't afford a private OT?
Thanks for that question. You know, I think what's really important to remember is that there's a lot of strategies that the teacher can really implement in the classroom. So consultation is probably the key piece, at least at the beginning, in understanding what are the challenges. If there are these writing activities, what are things that can be done both at home as well as in the classroom, so that if there are not, that availability for OT supports, if everybody has more knowledge in terms of both the sensory and the motor components that are feeling challenged, then those can be addressed really at the same time. And the keyboarding piece, I think, is really an effective piece. We're definitely starting it a lot earlier, although I just want to emphasize how important it is for them to learn to write. So I think that we can't forget that piece and can't jump just to keyboarding, because it really is critical and still key. Even with the accommodation that these students may get, they really still need to know how to write as well.
And if
I've had some success with speech to text, and for slightly older students, maybe 4th grade, 5th grade, because this is a verbal population, that's a strength. And again, that's another avenue for accommodation, for support. It doesn't replace handwriting.
And if I could add, sometimes a family might not be able to afford a private occupational therapist, but often these children will qualify for occupational therapy at school. So there could be a school OT who's helping. And a lot of times it's real helpful, again, as a team building. You might have both, in which case it really is important that the school and the private OT consult, and they decide who's doing what, and they communicate so that both of them work together in a coordinated method. But I hope we don't forget that there are school resources, like a school OT also.
Good point.
We have several more questions, and we will stay on a bit longer to answer them. I hope you can join us and stay on with us. If you can't, I just want to give you a reminder again to be sure to register for part 2 of this webinar. You have to register for each part separately. And I also want to invite those of you who are not members of AET and are watching this webinar, that AET welcomes your membership. And there's information about various kinds of membership on our website, www.aetonline.org. And membership is available to anybody who is interested in supporting educational therapy and students with learning difficulties. So now,
Man, can I insert one thing? Because I think it's germane here. The authors, the editors of our book wrote a previous book, but they also wrote 2 shorter articles in the AET Journal. And it really discusses that central question about how is diagnosis made, and what's the difference between Asperger's, high functioning autism, and what are the proposed models and types for figuring out that issue. So that's available on the AET website for members. I'm not quite sure about non-members, Nan, whether they can have access to that.
okay, and I'm not sure about that either, but we can.
We'll have the answer for next time. How about that?
Anne has asked, I know a child with many of these struggles and benefits from many of the strategies, but is not, emphasizing not, a strong reader with strong verbal expression. Can such a child still have NVLD? Would somebody like to take that one on?
I'd need to know the age of the child.
Okay, and that's not mentioned, but if Anne wants to add that to the Q&A list, we'll come back to that question. Okay. Sandra says, I have a student that doesn't have the gross and fine motor deficit, only the visual sensitivities and most of everything else you're talking about. Is she struggling with something else, or is she still under this umbrella? And I'm betting that you're going to need an age for that too.
Not necessarily. Do you want to start, Dianne, or should I?
Well, let me just add one thing. One point I wanted to add was that each of these domains that we talked about could have a very different pattern. Some children may have a real mild part of one domain and quite a significant impact in other areas. And the next child may have a little bit different pattern. So it really does vary that way, which makes it more complicated. Marion, did you want to add to that?
No, that's exactly what I wanted to say. So just because the markers are not equally weighted or as severe, it doesn't mean that it's not NVLD.
Okay, thank you. And Anne has let us know that the child she was thinking about is 11 years old. Do you want me to repeat the question again?
No, I've got that, I think. Thank you. So it's Anne, right? Part 2, we'll talk a great deal more about this because this is my world. But there are The early aspects of reading, which have to do with, sight word acquisition, high frequency words, being able to read fairly fluently in the lower grades, often will change and surprise people by having, at 11 years old, having difficulties with different types of reading comprehension. And so I think that may be what's going on.
Okay, thank you. Another viewer asked that recently she heard that the first remedial step should be social skills training and wants to know, whoops, I'm sorry, my screen just jumped. Let me find the question again. Okay, and wants to know what you think about providing both OT and social skills training with a speech language therapist. Do you want to take that, Rebecca?
Sure. So actually, that's exactly what we do in our office. We run a lot of groups addressing the social skills. We do a lot with the social thinking from Michelle Garcia Winner and have found that to be very effective. And so we combine a lot of the social skills by addressing that sensory processing piece within it. I think it's really important to address the social skills. In my experience, sometimes we need to help that student with the sensory piece before they can enter that group setting. Because if those pieces, the sensory piece in particular, they're struggling with regulation, with keeping their body in control, it's much harder for them to then work on that social piece of reading the cues of others if their bodies are moving too quickly, for example. So we really work a lot on addressing some of that regulation and that sensory processing piece so that they can then join in that social skill piece. It's incredibly effective to have a speech therapist as well, because so much of what we're doing is helping them with the language to use. Reading those cues, having the language of what to say in those situations, and then having that greater awareness in terms of their body and space relative to their peers. So it's wonderful. It's really what we're doing a lot of in therapy.
If I could just add, yes, I think we want to have several of these things going on at the same time. As Rebecca said, we have to have some preliminary things to get ready, but then at schools, they often will have the speech and language person maybe working with the individual, or maybe the social worker. Several times at various schools, they will have a social worker who runs a friendship group, and they play games, and they watch the interactions, and they help the student develop more social skills. So there's a number of ways to be doing this, but I think obviously they're very important. One thing I do notice about students with NVLD, oftentimes they want to have friendships, and they want very much to be a part of the group. They're just not always sure how. So I think if we can provide that kind of support socially, it's very important from young ages all the way through older kids.
And there's another place where you might see a difference between the Asperger group and the NVLD group. The NVLD group is wishful, is wanting friendships. So helping is really good. And in California, we don't have school social workers, but we often have school psychologists who do run small groups like that. So it will vary from state, to area, to district, what kind of support services that are available in your area.
Okay, we have another question for Rebecca. Nancy asks, do you find that a third grader who has difficulty with manuscript writing, that in a child like that, cursive writing would be easier?
So it's interesting. We've had some success teaching kids to do the cursive. Part of it is that it's a slower process to learn, so it slows them down in the writing piece. And for some of those students, it's actually effective, because oftentimes when the writing is so challenging, they want it out, they want to work as quickly as possible. It's difficulty, they experience difficulties because of the control with their pencil, the fine motor skills, all of those pieces combined. So in cursive, it's really it's a piece that slows them down a little bit. It can also be on the flip side, it can be very frustrating for a lot of students to learn. I know here in Chicago, there's a lot of schools that are moving away from cursive. So I think it's really important to learn the cursive, because you're definitely utilizing different centers that, in the brain that are important to learn it. So I think it's a little bit of trial and error trying to see if that would be a more effective mode for them.
Printing requires more stops and starts and oblique angles, the connections at exactly the right points. Think of a K going in and out, a V, touchdown, back up. How do you do that? So printing, manuscript printing is really challenging for many students, and particularly those with NVLD. So in theory, cursive will work better because there's more fluidity. But in my experience, there are very few students who want to learn cursive because they've struggled so with handwriting. It's worth a try.
Okay, and this may have to be our last question for today because I know Rebecca's time is short. Can students still meet the criteria of NVLD if the reading and spelling skills are a challenge as well?
Sure. How about that for a short answer?
Okay, anybody want to chime in on that, or shall we move on?
There were a couple very specific questions that are sensory. I wondered if Rebecca liked trampolining and barefoot. So I was reading through a few.
Oh, I'm sorry, I missed those.
Early.
And you know what? I'm sorry, I did not look at the questions, so I can take
Well, you were talking, it's impossible. I didn't get the mic to go right. So.
The trampoline, the one piece just to emphasize about trampolining. So it's really a very intense sensory motor experience when you're jumping on those trampolines. There are some kids that it's very effective. It gives them that input to help them regulate their system. I can think of students of mine that come home, go down to their basement, and they will jump on that trampoline for 20 minutes after their school day, and then they're ready to do their homework. It gives them that activity that really helps them to organize their system. The piece about being careful is it can send some children really high up. So we have to be really mindful and really watching to see, is it starting to increase their excitability? Because then it's going to have the opposite effect. So that's why it's really important to really watch to see something like trampolining can be for a student. So it's just something you have to really watch out for. Okay. I don't know. I didn't hear the barefoot question.
Yeah, the question was, do children with poor registration like to go barefoot?
There are a lot that do. And the poor registration, we have a special brushing program, which really helps some of that tactile piece and gives them that increased registration. So there are different ways. The other thing that's effective too is actually wearing things like running shoes, because running shoes give them that added input. So for those kids that have that poor registration, giving them that extra feedback can also be very helpful for them. But we've had lots of activities where they are barefoot on different kinds of materials. So it's giving them extra input, which I think they are really needing to register sensations.
Okay. One last thing. Somebody had asked what the YouTube video for parents was, and Marion answered that in the Q&A, which I believe may be available.
I'll just say it again because I realized some people didn't download the handout. So the things, and there was a question about handwriting programs too, that for you, Rebecca, but they're in the slides if you download that or listen again. But just to say for everyone, the video is Understanding NVLD, Nonverbal Learning Disabilities, 2014, by director Jacob Basri, and it features the two book editors, and it's a really lovely overview. Understanding NVLD, YouTube.
Okay, and thank you again so much, Rebecca, Marion, and Dianne. You just shared such a wealth of knowledge and expertise, and it's been very, very valuable. And thank you to our audience. There are a lot of hearty souls who stayed with us, and we're looking forward to seeing all of you next week when we do part 2.